Hi, Dr. Randy Grill, and this is To Dentists Only on must organizations you should belong to. Now, belonging doesn't mean just like, it's a political organization. You belong for the knowledge they have. Most of the time you'll notice I say this is my opinion or this is evidence-based dentistry. This is my opinion that if I hadn't been involved in these organizations, I would have flushed out of nursing home dentistry because it's too difficult. The kids, and especially the daughters, often want things that will kill their mom or dad. They do not know dentistry, and it's your job to educate them. And if you educate them out of your opinion, you're going to wander in with them like I did on somebody that had a TIA in my chair against my will. I stopped. I said, this is the risk and everything. But today, I won't do that. When I know that mom's stressed out, SOB, different things like that, because of the knowledge of these organizations, and not because I just went to the meetings. No, I read their materials. I read the books they have. Special Care Dentistry is my top organization, and in that is the American Academy of Geriatric Dentists. And it's not, you can go back in their archives once you belong from 1980. I've said before that Ron Eddinger, the editor of that, has been there since then and is one of my heroes. You don't have to, I used to oversee kids in hospitals. I used to put MRs to sleep in hospitals and do dentistry back in Kansas years ago. And I would read Special Care Dentistry differently then than I do now. I want the articles on oral care, on nursing home, long-term care, especially the one in 1984 that's established, and all the articles from 80 on build on each other. And you've got the articles that I've recommended that must read. So Special Care Dentistry, critical, but not just to join, not just to go to the meetings and putz around and have fun in Scottsdale or Chicago. It's the information on their website. And it doesn't just go there. If you don't spend an hour a day in studying for your first couple years, you're going to get washed out. And there are things coming down that in dentistry, like Kiss Your Dentist Goodbye. I'm on a lot of services, and that is a big buzz today in non-dental circles, and I know what they're teaching is right. And Dr. Ellie Phillips, who was one of the co-founders of the American, I've got all these American Academies for Oral Systemic Health, is another organization, the AAOSH, is all about the connection between diabetes and perio and bad teeth and all that. And you and I have to make decisions all the time in connecting the dots between the risks. Yes, there's leaking infection. In fact, I should have some records included in the samples that are true of me saying the leaking infection has equal risk of the extractions, and it's a POA's decision to make that. But if you don't know anything about or involved with the literature where the physicians are teaming with dentists in this AAOSH, as like their meeting in May will be at the Cleveland Clinic, physician clinic, and so they're connecting the dots, and we now have partners as physicians, and you have to make these decisions, and you will find it difficult to make those tough decisions, because at the end of the day we have to look at the POA and said this was our best choice given the evidence and given our opinion, and yes, we're sorry that mom passed having the extractions out. But if you willy-nilly don't know any of this information, you can't inform the POA that equal risk of leaving the bad teeth in or the hopeless teeth in and extractions, and it's their decision on which way they want mom to go. This is just the life we live in. Another one is the American Academy of Oral Medicine. Their 2 clinical books are critical. This is just knowledge. Without Oscar, how in the world can you practice? And Oscar will send you onto the web to find out how long, an average, median, all these things you've got to understand how long the average person lasts in your practice. And so in mine, most of my patients last 3 years, some 4, rarely 5 or 6. Some of my MRs, 10 years. So you treat all those different depending on their reality, which is part of OSCAR. And this is critical because if you overtreat, you are going to trigger major declines or terminal events. In fact, the number of people that I've even fought the state who a little lady wanted all of her teeth out, and I said no way. And of course I could list all the comorbidities, but poor healing was going to be one of them. And a major decline is triggered often after numerous extractions. So they can't wear dentures anyway, and so you need to inform the POA often and have them make a decision. In fact, every new patient we have, we send my card, a little form letter, the first notes, and saying, we won't send any more of these out, but if you want to get a hold of us, here it is. So there's no excuse. I've had somebody 5 years down the line disagree with my treatment, and that's when we started sending out letters that their sister was limited care, and she was livid. She was livid that we weren't doing general dentistry on her, and to me, that's going to kill the sister. I won't do it. They can find another practice. This doesn't happen very often, and most of the times when you stick to your guns on the type of care you've chosen for them because it's appropriate during to their awaken or AO and all their morbidities, oftentimes multiple morbidities and medications. But if you don't know what all these things do and say, you're just shooting in the dark. You're a general dentist with an opinion on older people. So we've got special care dentistry with a component of the American Academy of Geriatric Dentists. We've got the AAOM, the American Academy of Oral Medicine, and we have American Academy of Oral Systemic Health, and also usemyyoutube.com nursing home dentist. And all of these videos, even though I say dentist only, POAs are going to watch. They should know. So you're going to have to get up to speed. If this is a job, get out. If you're biding time to buy a private practice, get out. You can hurt people here. You must make this your calling, your niche. And by the way, as there's an ADA study coming out next month in April, it's March 2012 right now, that says 60% of the caries are inactive that we do fillings on. It's going to make for an interesting world because now general practitioners are going to try to dive into your practice, and you better be established, you better know your stuff, and you better make sure they're safe with our patients. Okay, you've heard my opinion. It's a strong opinion, and this is a great place to be. It is an incredible place to be. You can't, once you can connect the dots or start connecting the dots, you can't be replaced. And none of our patients can walk into general practice, and when they do, when the daughter forces it, they're in trouble. Okay, Dr. Randy Grill, Nursing Home Dentist. This is a dentist-only film for organizations you must join for the knowledge. Thank you.